Hello. Daily treatment notes. Every setup and situation is different, kind of depending on your facility. But what is the most important to capture in your daily treatment notes, because these are usually the notes versus evaluations that insurance companies and facilities looking to accept patients for the next level of care are looking at. You need to capture what your patient did during the session and how they were able to perform those tasks, the limitations and barriers that they face that are preventing them from being independent and from functioning at their prior level of function. The most important component that is often missing in notes is the parameters in which these activities occurred. So it's great that I know that the patient was mod-assist for grooming, but was the patient mod-assist for grooming sitting edge of bed, or was that standing sink side? Those are two completely different scenarios and setups. And so it's really important to talk about the parameters in which the activities were performed by the patient. So don't forget to include those things. Then really understanding how your entire note is read as one complete entity. In one section of a note, I would read that the patient was supine for the duration of the session. And then later on, I read and I look and see that you were working on self-feeding. And then I'm like, wait a minute, but back here you said that the patient was supine during the duration of the session. Well, all of us know that you shouldn't feed a patient in supine. That causes a whole list of secondary complications, and is very unsafe. Do I think this clinician fed a patient in supine? No. I think that people don't think about semantics, and they probably were thinking to them like supine meant the patient was in bed for the duration of the session, instead of like what supine actually means, like with laying flat on your back. So really think about your word choice and how if you put something in one section of your note and something else in this other section that are incongruent or don't align, that can become problematic. And so really think about that when you're documenting. The other thing is precautions. Think about how you choose to word things based on if you know the person has a sternal precaution or they are not supposed to move a specific joint. Don't be lazy and just say, we did upper extremity, self range of motion, and you know that one of those joints isn't supposed to move. You need to be explicit and said, did digit, elbow, and wrist range of motion, shoulder joint was protected during these exercises. It's very important to include how you educated the patient or how the patient protected a body part that has a precaution associated with it. That information needs to be included in your note. Along with education. I know that education isn't billable always, depending on how you achieve that. But if you provide education to a patient or a caregiver, it needs to be documented, because if it isn't documented, it didn't happen. And that needs to be included in your documentation, because if it's not, then that opens you up to patients that were like, well, I was never educated, and then they had a complication associated with not following precautions. They would have supporting evidence if you never documented that. Along with, if a patient struggles with maintaining or adhering to precautions, that needs to be documented. All of this stuff needs to be captured. So those are some of the most important things that I see forgotten in daily treatment notes. And so hopefully this will help you write better daily treatment notes. Thank you.